The following is brought to you by VerticalVet. Rethink your GPO.
Hi, once again, I am Dr. Ernie Ward, Executive Director of Education for VerticalVet, and I am so pleased to welcome you to another special edition of our Real Talk series. And this time we're going to talk about a topic that's really, first and foremost in many veterinary practices' mind, and that is the fear-free movement. I mean, many of you at least know something about it. It's kind of this safer way of dealing with animals, try to reduce the stress and anxiety that both the pet parent and the pet experience when they're traveling to and from the veterinarian. And so this week we're going to take a slightly different twist on it and talk about the business potential for fear-free certification for your entire practice. And I'm really delighted to bring to you not only a dear friend of VerticalVet and my own, but Michael Hargrove. And he's going to talk to us a little bit about his experiences and his perspective on why fear-free practice certification just might be the thing that you need to think about moving forward. So Michael, thank you so much for joining us.
Yeah, thanks for having me.
Well, so where are you calling us from today?
I am up in snowy Duluth, Minnesota.
Oh, God bless you, man. It is 76 degrees here on the coast of North Carolina. I bet it's not that warm there.
It is snowing right out my window, so...
Oh, man. I am not a snow fan. I think everybody is well aware of that. I'm a beach guy. I like being outside in the warm sunshine weather. So I'm glad there are people like you, Michael, that are able to weather those cold Minnesota winters.
Well, the good news is I'm just up at the beach of Lake Superior, so it's not the same warmth that you're used to, but we do have the water in the beach. So,
golly Moses, I did the Racine half Ironman several years ago up in the Great Lakes, and I was prepared. Like I've done Alcatraz and done some other cold water triathlons in my career, but that was a really surprising one to me because it was in July, and you're like, okay, it's going to be a nice day in the water, and no, it was bitter cold, and then it was brutally hot. Like that was the nutty thing. It was like you just got out of this 60-something degree water, and then it's like, oh, and we're going to now throw 100 degree, at you, so it's okay. Well, anyway, we digress, but it's a delight to be here with you today. I really am excited to talk about this topic because I think a lot of us attach sort of the personal, ethical, moral, compassionate elements of fear-free movement, but we don't really think about it in terms of business. And you and I both agree this is actually something we think is essential for practice growth. But maybe if you could just start out by explaining a little bit about what you do, why you're here, and why you're excited to talk about fear-free practice certification in particular.
Sure. Yeah. So I am a practice owner. I'm a 91 grad, so I've been going for about 30 years. I've been a practice owner for the last 16 years. Our practice has always focused on the human-animal bond. We got into low-stress handling maybe 5-6 years ago. I was speaking at a AHA conference back in 2016 and went to some fear-free talks, which was kind of when fear-free started, and it just resonated with me. This approach is exactly what I think it was a way of articulating what we already believed in and bringing more structure and format to it. So I got super, super excited by that talk and went back and brought it to my practice. And within 3 months, my entire staff was fear-free certified. And so then 2 years later, 2018 is when practice certification started, and we jumped on that as quick as we could. We were the 7th practice in the country to be fear-free certified. So super proud of that. The other side of the other hat I wear, though, is that I'm a business consultant, a practice consultant. I'm a certified business appraiser, and I have an MBA, and I've been in the consulting field for 20 years now. And I do a lot of work around profitability and practice appraisal for veterinarians that are buying and selling practices. And so I always try to look at everything I do in practice from the business standpoint, and how does this help not only my business, but how would this help other businesses? And so that really, got me interested in how I could speak to fear-free from the business perspective. And if you don't mind me telling a quick story, I was, in our local community, we've got maybe 7-8 veterinary practices, and we have CE meetings, just like every community, that are sponsored by various companies and that kind of thing. You go to dinner at a local hotel and get an hour or two of CE. And those typically 30 to 50 people attend those sessions. And so Siva came and did a talk on fear-free, and there were 150 people at that meeting. I mean, this is basically everyone that worked at veterinary practices in our community. And so number one, that blew me away. I mean, just the interest, the passion that people had. It was a great talk. But cut to a year later, and I did a search of fear-free professionals in our area, and it was our practice, everyone in our practice. There was one other practice that had also started prior to that talk, and not a single other fear-free professional in the community. And so to me, it's like, why did that happen? There was 150 people there. There was this interest. What was the disconnect that then nobody moved forward and did it? And I think a big part of that is a lack of buy-in from leadership, from practice owners, from practice managers, that there must be some barriers to committing the time and money and effort to get, fear-free certified. And so I thought maybe this is a way that I can get out there and help promote fear-free, because if I can convince the managers and the practice owners of why it's good for your practice, why it's good for your business, why that will come back to you in the form of dividends and better practice value, that might be another way to help encourage people to do this. I mean, I would hope that the benefits to the animal is enough to encourage people, but I think there are some sound business benefits and reasons to do that as well.
Right. And Michael, that's one of the reasons why, at VerticalVet, we partnered early on with Fear-Free, because we do see a wide array of benefits, both to the individual practitioners, whether they're veterinarians, veterinary practice managers, owners, assistants, whatever, but also to the practice economics. So I'd like to ask you about that. I think that's a great starting point. What are some of the tangible revenue, income, appointments? I mean, I'm already preloading the conversation. But what are the real benefits that you like to talk about for being fear-free certified for the entire practice, not just you as an individual?
Yeah, so I mean, I think there's a whole plate full of both tangible and intangible benefits. I think that at the core is the client experience. I mean, I know one of the most traumatic experiences of my life as a parent was taking my son in to get vaccinations and him being so fearful. And I remember bear hugging him while they gave him 5 shots in the leg, and he was screaming, and it was one of those experiences where it's like, oh my God, did I just betray the trust of my child? I mean, I'm holding him down, and in his mind, he's being tortured, and that certainly, he didn't want to go back to the doctor to get more shots, and I didn't want to take him. That wasn't a good experience for me either. And I think that, there's the Bayer study. I think we know that especially with cats, but also with dogs, that fear of travel, the fear of being at the vet, is a real limiting factor as to why people want to take their pets to the vet. And so if their animal can have a better experience, if they can actually enjoy coming to the practice, then the clients are going to actually enjoy that as well. And that customer experience, I mean, businesses all over, outside of veterinary medicine talk about the customer experience and that dynamic of how we bond people to our businesses. And so having a better client experience when they come to our practice means people are going to come back more. They're going to come in the first place. So that cat that maybe doesn't need vaccinations this year, but does need a health exam, in the past, maybe they wouldn't have brought it because it just wasn't worth it. But if they can have a better experience, maybe they start to come in. And so these things have actually been studied and have been shown to be the case. Vet Success partnered with Fear-Free, and they're tracking about 20 practices that were early adopters of Fear-Free, and they're showing that people come back more often. People come in, more clients come to these practices. They have more repeat visits. Think about the ear infection, that that animal's painful, they have an unhappy visit because they're getting probed and they hurt and they're uncomfortable, and then we say, please come back in 2 weeks and let's check that ear again. Who comes back? As long as it doesn't stink, they stay home. They don't come back. But if that was a positive experience and they were comfortable being there and their pet was comfortable being there, they might actually come back for that recheck. So that's number one, is just having a much, much better client experience. And that bonds them to your hospital. It makes them more likely to come back. It makes them, they're going to spend more money at your practice. There's no doubt about it. And I also am a big believer in value creation. And when you have a tangibly different experience at this hospital compared to another, that's something that you potentially can even raise your prices, because if you're creating more value and they're more likely to come to your place than they are somewhere else because they know they're getting more for their money. I talk to my staff all the time. We have a road right here in town where there's a McDonald's just down the street, and then there's a restaurant called Blackwoods that looks out over the lake, and they're just 2 blocks apart, and they both sell hamburgers, and Blackwoods maybe sells a hamburger for $12, and McDonald's, you can get one for $1. So do people go to Blackwoods and sit there and complain that they're getting a $12 burger and they could have got one for $1 down the road? Of course not. But it's the quality of the service, the quality of the product, the view, the ambiance, all of that kind of stuff. And it can be the same for you. And I always talk to my staff, do we want to be Blackwoods or do we want to be McDonald's? And so this is one of those things that differentiates our practice. And I'll talk a lot more about that as we go on, but we've even done some physical things that are just different. I mean, when you walk in the front door of our practice, it is different than any other practice they've been to. And so that just translates to a different experience. So
yeah, and without a doubt, differentiating any business, any service, any product is an important element to making a stand in a marketplace. Let's get back to that conference that you alluded to earlier. So 150 people show up. They're super excited, enthusiastic to learn more about fear-free. Yet a year later, very few practices have actually implemented, at least as far as you could tell. Right. You mentioned in the outset you felt like sometimes it was the management that was holding back. You said sometimes the staff wants to, but it's the management, the systems, the processes in place that actually throttle back that progress. So maybe speak to that. Like, what do you say to managers and owners who they go, okay, look, I get my staff wants to do this, but it seems like an awful lot of work or an expense or something. How do you overcome that particular objection?
Sure. No, that's a great question. And that's why I'm here. that's why I try to speak on this. Just another quick story. Once you're fear-free certified, you can join a closed Facebook group for fear-free, and where fear-free professionals are talking about their experiences, asking for advice, different case situations, different animals, all that kind of stuff. But, early on, I was seeing technicians in particular post and talk about how they were so interested in fear-free and they adopted fear-free, but they're just getting pushback. They're getting pushback from the doctors. They're getting pushback from management. Nobody's willing to embrace that, and how unhappy they are, how disgruntled they are, and ultimately how they would leave these practices. And that, again, just kind of solidified for me that there needs to be a way to, come from the top down and really talk about this from a business side. We as practice owners, we're faced with financial decisions all the time. And, do you buy a laser? Do you buy an ultrasound? Do you buy the new x-ray machine? And we always do these cost-benefit analyses. Fear-free is an investment in your practice. It's an investment in your staff, and you need to think of it that same way. Yes, you're going to put some money and you're going to put some time into it, but just like anything you spend money on, you're going to get a lot of benefit back out of it. I would also say I firmly believe, given the incredible speed at which fear-free has been adopted, it's not going to be too long before fear-free is standard of care. And do you want to be on the front end of that, or do you want to be on the back end of that? Yeah, I think initially practices like mine, we're differentiating ourselves in a positive way because we're doing this thing that the public is interested in, that our staffs are interested in. And I think couple years down the road, if you're the practice in town that isn't doing it, you're going to be differentiating yourself in a negative way. And so, that is something that's, I feel that just from a trend standpoint, it's what people are asking for. And so again, I'm all over the place because there's so many different benefits, but right now, 22 out of 30 veterinary teaching colleges are requiring fear-free certification before their veterinarians graduate. 20,000 out of the 35,000 veterinary vet tech students in this country are becoming fear-free certified before they graduate. What practice are they going to look to go to when they come out of school? And this is how they've been taught, that you need to handle animals, pay attention to their emotional well-being. And then we all know, how hard is it to hire an associate veterinarian right now? How many jobs are there available and how many people are there to fill those jobs? If they're looking for a fear-free practice and there's only 140 of them in the country, that's a real hiring advantage. Just a year ago, I had 5, remember, I'm in Duluth, Minnesota. We already talked about that, the cold, the snow. I had 5 doctor resumes on my desk, and we weren't even advertising for a veterinarian. And I knew other veterinarians around the country through my consulting business that had spent a year trying to find a vet and couldn't even find one. So that's just one benefit, but that's a very tangible benefit. Vet techs these days, how do you find them? How do you hire them? I find that our staff, our technicians, our assistants, it's super, super easy buy-in to talk about fear-free, because it's what they went into this profession for, to care for animals, and to say, we're now going to put an emphasis not only on the physical health, but on the emotional health. We're going to pay attention to their fear, anxiety, and stress, and we're going to try to do something to alleviate that. That's a no-brainer. It's an absolute no-brainer for our staff that care about the animals. It's why they came to this profession in the first place. But if they have to pay a couple $100s to take a course, right, and then they come back, so they put out their own money to do it, and then they come back to the practice and nobody supports what they do, why would they do it? Why would they pay that money and then not get the support? And I think that's where, like for me, when I came back to my staff, I said, not only am I going to pay for all of you to do this, I'm going to give you each a $100 bonus when you finish the course, because I wanted to emphasize to them that it was something I really was passionate about. And like I said, it took 3 months and my entire staff was fear-free certified. They already believed in it, but then they also had leadership that said this is important. And then we started to develop that culture change.
Yeah, I love this. And, some other additional benefits. I agree with you. Number one, it is an attractive, element to maybe recruit new staff. So whether they're associate veterinarians or registered vet techs or whomever, I think it's also very appealing to them. But one other aspect too that doesn't get talked about enough from a practice management perspective, and one of the things that I've always been incredibly sensitive to, and that is injury avoidance. There's nothing worse than having a staff or a client, of course, injured during the course of an examination or treatment. And so maybe talk a little bit about that from a practice management. I know that may be slightly out of the scope of our conversation. I didn't mean to blindside you, but I think it's something that bears talking,
Yeah, no, it's something that I talk about. I think that there's, staff retention and hiring benefits. I think when people love their job, they're going to stay in their job. And then workplace injury is another whole aspect. Having people out of work because they've been bit, having people afraid of being, bit or scratched or those kinds of things. And, the bottom line is being fear-free doesn't mean you're never going to have another injury in practice, but it means that you're paying attention. And more than anything else, you're stopping when you need to stop. So many of our injuries, sure, there are those animals that just completely catch you off guard, but for the most part, they warn you. It's reading their body signs. It's paying attention to what's going on. And instead of saying, oh, this animal's really freaking out about this nail trim, let's grab a muzzle and 2 more people and hold them down and get it done. This is why we get bit. This is why we get hurt. And having a culture where people say, hey, we need to stop, we need to slow down, we need to take a different approach. Maybe we need to do this on a different day. Maybe we need pre-visit, pharmaceuticals to help make this a better experience. But all of that, not only does it create a better experience for the pet, but it means we're a lot less likely to get hurt. And there are actually workman's comp insurance companies that are giving discounts to practices that are fear-free certified.
Wow.
Yeah, absolutely, because they can see the tangible reduction in claims, and so they see that. And so I feel pretty comfortable if there if there are risk management people out there saying, hey, we can charge less for practices that do this. It's because they're actually seeing reductions. It's not just something that we talk about as a hypothetical.
Yeah, I love this. And again, I think that anything you can do to enhance the experience, reduce anxiety and stress for the pet parent, that's going to bond them to your client, to your clinic more loyally. And I think that client loyalty in this day and age is something to be treasured. You need to do everything in your power to pursue it because, let's face it, they've got more choices than ever. In fact, many of them reside in their smartphones. So, we need to really up the physical experience because there's nothing that has less stress than clicking a button on a phone. So I think that this is why it's doubly important today to really lean into this type of practice.
Yeah, 100%. I mean, it's something I'm really passionate about. And I don't think we talk a lot about brand and brand loyalty in this profession. But as a practice appraiser, not to get too deep into whole practice value and everything, but the ability, when you buy a practice or buy any business, there's two aspects to what creates value. One is the money. How much profit there is. When you buy a veterinary practice, you're buying the right to that profit. So that's just something that it is what it is. The more profitable your business is, the more value it's gonna have. But the other part of that is we always hear about these multiples, capitalization rates, discount rates, return on capital, whatever you want to call it. It's the other whole part of an equation. It's profit times something equals value. Well, this something that we talk about is risk. And it's the risk of, if I buy this business, how likely am I to actually get the profit that they've been getting in the past? That's really what it boils down to. And anything that can reduce risk will increase the value of that business. And the ability to transfer goodwill is kind of the technical way that we put it. But the ability for a new owner to enjoy the goodwill that the prior owner had goes a long way towards increasing the value of a business. And so a practice that's built on the reputation of a single veterinarian, that's personal goodwill. That's goodwill that resides within that individual. And so as soon as that individual leaves, as soon as Dr. Wonderful leaves that practice, a lot of clients leave with them because they came to see Dr. Wonderful. They didn't come to see the practice or it wasn't the staff that brought them there. It was Dr. Wonderful. But when we can change that so that our brand is about our entire practice, about from the first phone call to to when they walk out at the end of a visit, that every step along the way help to bond them to our practice, then if we sell, all of that is retained. Everything except us, we're gone, but that whole experience, that whole culture, that persists beyond the sale. And that dramatically increases the value of a business. And so what I love about Fear Free and why I am passionate about practice certification is that it creates a culture for the entire practice that creates that brand loyalty, because it's the whole practice that's doing it. When you have one or two people, and that's how you have to start, but when you have one or two people that are adopting Fear Free and the rest of the practice isn't, that doesn't create a culture. That creates a person that people say, I want to be with this technician, or I want to be with this doctor. But it's not so much that they're bonding to the practice. If that technician or that doctor left, they might leave as well. But when you get to that practice level certification, that's an entire cultural change. You're all supporting each other in those activities. When you say, hey, I think this animal is getting stressed, the person next to you is saying, I agree, we need to do something about that. You're not on an island, you know. And it's just, as I say, it's from the moment they call and your receptionists are talking about how to make it a better trip into the office in the first place. You know, how do we get those cats to feel better about the travel? It's the experience in the exam room. I mean, we have music and quiet rooms and non-slip floors and pheromones and treats, and you know, it's just an entirely different experience. And if I sell my practice, they're still getting pheromones and treats and music and quiet, and you know, a staff that cares about their pet, about the pet's emotional well-being. None of that changes when I leave. And so it's that kind of brand development that is really going to create more brand loyalty. It's going to make people want to keep coming back to your practice while you're still there. But even after you're gone, that's something that will persist.
Yeah, I love that. There's a lot to unpack in there, so you may want to rewind this webinar and go back, because that's a masterclass right there. But real quickly, you know, as we're talking about creating value, I mean, obviously there's two value props here. One is to the pet parent, and the other perhaps is for the business revenue, even possibly an exit or, you know, transaction later. Let's focus back on the client. So, you know, we talk about loyalty and all that stuff, but what are your best practices for, you know, getting the word out? Because I think that, you know, we keep talking about differentiation and improving, you know, number of transactions, number of visits, and spend per visit, all that stuff. So, but how do you suggest that a practice actually promote that? You know, so do you, well, I'll let you go.
Yeah, no, I mean, right. I mean, this is so hard because we could do a whole hour on practice value, a whole hour on marketing, a whole, you know, I mean, it's just, there's so many aspects to it. I mean, the biggest thing for us, and admittedly, this is one of the most difficult things about being fear-free in a COVID world, is that 90% of what we do fantastic for our clients that they see, they're no longer seeing. We're still doing it all, but they're out in their car. So they don't see that pet experience. They don't see, you know, how we react. And so that it is difficult right now to be promoting and marketing and showing people, you know, the benefit of the visit when they're just stuck out in their car and we're doing all our good work behind the doors. But anyway, I digress. COVID won't be forever, I sure hope. But no, but in any case, it's, you know, it's being front and center. I mean, in my experience, certainly in our community, word of mouth, personal referral, those are the biggest marketing tools. And so when a client comes in and has a positive experience, but you need to talk about that. You need to show them, you know, it's just like an exam. You know, I was taught to create value with your exam. I mean, I'm sure we've all had an exam where we talk with the client, maybe we chat about their summer vacation or their kids or whatever. We do the entire exam. We might even give shots, and they don't even know we've done it because we're just talking about the summer, you know? But if you were to say, hey, you know, I'm looking in the ears, here's what I'm seeing. You pick up the lips and look at this, look at the tartar on these teeth. You know, when you create that value, when they leave, and that bill, you know, it's a $65 exam or whatever it might be, and they say, I don't even remember them doing anything. That doesn't really create value. But if every step along the way you talk about what you're looking at, what you're finding, if they have a report that goes home that shows all the systems that you looked at and the comments that you make, you're creating that value. Well, you can do the same thing with fear-free. You know, when you talk about how you're keeping your hand on the animal all the time so that it's not all these, you know, jerk reactions and everything, there's this touch that's there, that you're minimizing people coming in and out of the room, and that's why we want to draw blood in the room, but are they okay with that? You know, it's walking through every step. Is it okay if we offer your pet a treat while we're doing this ear exam so that we can look in there and they won't even know what we're doing? By talking through and narrating some of those things, it really helps to show them what you're doing and not just have it kind of happen, but they don't even realize that it's happening. That being said, we also have a professionally done video that shows all of the things that we do in our practice that create a fear-free practice. I'll put a plug out for Videos. They do a fantastic job with their videos. We have a whole page on our website that's devoted to fear-free and all the things that we do to help improve that patient visit. I have I started a house call service, and I've got a 24-foot truck, and it drives all around town and has the fear-free stuff right on it. And so, we're constantly trying to promote that. Our truck is in the Christmas parade, and when the truck goes by the cameras, they talk about fear-free care, so, and we were in the newspaper. I mean, we had Marty Becker came, and he and I sat on the news and talked about fear-free and what it meant to our practice. So, it's making a positive effort to really let people know what you're doing, what makes it different, and why they would benefit from coming to your practice.
All right, so as we wrap up today's discussion, let's go back to that first seminar, conference, dinner meeting that you talked about. There's 150 people in the room. They went back home. Only a handful actually did anything. We've now reconvened. We've got that same room with 150 people. And what do you say to them this time to say, you need to really take this more seriously? So how do we convince those skeptics that were back at that conference to actually become adopters?
Yeah, when I give these talks at meetings, I say, for the managers and practice owners that are here, these are all the reasons why I think you should adopt us. For those that aren't practice owners, these are the reasons you should take back to your boss. It isn't, the animal part is huge, and I don't mean to minimize that. Gosh, I'm 30 years out of vet school. It seems weird to talk about, but there was a time that we didn't put catheters in every single surgery case, that we didn't do pre-surgical pain medication and post-surgical pain. We had our anesthetic drugs, but pain management wasn't such a big thing. These are all positive changes. As we move on, it's like we need to do a better job of taking care of our patients. And so, I don't want anybody to lose that passion. I don't want it to be all about business. There's a valuable reason why we're focusing on the emotional well-being of the pets. But to let the owners, the managers know that there are all these benefits. You're going to retain your staff. One thing I didn't even talk about, and just super, super quick, but look at the suicide rate in our profession. Our emotional well-being is also important. And when people can come to work and feel better about the job they do, when they can go home and say, look at that animal that used to be afraid to come in, and now they come in and they're wagging their tail. And yes, it took us 12 months to get there, but that warms our hearts. It makes us love our jobs. It makes us not go home and have depression around our role in the practice. And so there are those benefits, but then start talking about, the benefit of more client visits and increased revenue and a better client experience and more bonding to the practice and all of these things that can happen. And hey, when you decide to sell your practice, it'll be worth more then as well. I think there are so many good reasons. And then you put it into a cost benefit. It's a whole lot better investment than a lot of the things that we spend money on every single day.
Well, I love that. I really wish we could reach those 150 at that meeting with that message, because if that doesn't move them, Michael, I don't know what will. So Michael Hargrove, thank you so much. Anything else that you want to leave our viewers with? Any last little words of wisdom?
Oh, no, just keep up the good work. I tell you, it's so hard with COVID right now and curbside care and trying to provide the best service we can, and just hang in there. Pets have never been more important. I think we see that. Every practice I talk to is busier than they've ever been, and it just shows the importance of that human-animal bond. And I think that the more that we can recognize the role that animals play in their people's lives, and we can celebrate and focus on the health of that relationship, that's where this reduction of fear, anxiety, and stress, and helping the emotional well-being of that animal, that creates an even better bond with the client and with our practice, and allows us to provide the care that we so desperately need to provide for these pets. So I encourage you to look into fear-free. There are solid reasons to do it. I also encourage you to reach out to me if I can be of any help to anybody. I'm happy to do that.
Oh, wow. Well, that's why we partner with people like Michael Hargrove. That's why we are proud to be associated with Fear Free and bring it to our membership, because we think it's really that important. Thank you so much, Michael. Well, listen, guys, that wraps another one of these wonderful Real Talk sessions. This one, again, very interesting, because we need to also, I think, somehow add up the benefits financially to our practice to adopt Fear Free, not just the emotional one. So I really appreciate Fear Free for sponsoring this episode, being one of our partners. And I really want to thank Dr. Michael Hargrove, because, you know, he is out there just making tremendous change and benefits for our pets and our profession. So I really love that. Again, if you have questions, definitely you can reach out to us at VerticalVet, verticalvet.com. Reach out to your customer service rep or just give us a phone call. We are here to help. If you want to find out some of these special programs that we have in conjunction with Fear Free, some of the discounts, rebates, and other programs that we offer exclusively to our VerticalVet members, definitely get in touch with us. Until next time, I can't wait to have, you know, more of these conversations with you. And if there's a topic that you want us to address at Vertical Vet, let us know, because again, we're here to serve and help you optimize your profession. So thank you again. I'm Dr. Ernie Ward, Executive Director for Vertical Vet. Have a great day.